Hello everyone. Today we are going to discuss on the topic of CPR. So first of all, let us discuss what is CPR. CPR means cardiopulmonary resuscitation. Cardio. Cardio means heart. Pulmonary means respiratory system. And finally, resuscitation. It means the act of bringing back from apparent death or unconsciousness. CPR is also called as BLS, basic life support. There are two types of CPR. First one, which is basic CPR, and second one, advanced CPR. What is basic CPR? CPR when given without the help of any equipment is called as basic CPR. Second one is advanced CPR. When equipment and drugs are used in CPR, it is called as advanced CPR. Also known as ACLS, Advanced Cardiac Life Support. CPR is only a symptomatic therapy. It is an emergency life-saving procedure which helps to maintain arrested breathing and circulatory system. It helps provide oxygen to vital organs until help arrives. So now let us discuss indications of CPR. CPR is given in following conditions. First one, cardiac arrest. It is given in other cardiac emergencies such as tachycardia, asystole, ventricular fibrillation, etc. Second one is respiratory arrest and carbon monoxide poisoning. Third one is accident, which is drowning or injury. Fourth one is electric shock. Fifth one, foreign body airway obstruction. And sixth one is drug reaction or drug overdose. Now basic CPR. There are 6 steps in basic CPR. So we will discuss steps one by one. Step 1, which is assessment of unconsciousness. The cardinal features for the assessment of unconsciousness are apnea, which means absence of breathing. Second one is absence of pulse, dilated pupil, unconsciousness, cyanosis and fits. Observe the above signs and chest movements in patient. If there is no breathing, it confirms that the patient needs assistance. Step 2, call for help and AED. AED means automated external defibrillator. The chances of resuscitation are lower with basic CPR. It is important to get help in form of ambulance services for advanced CPR as early as possible. Step 3, feel pulse. So now we should check for the pulse or other signs of circulation, which includes coughing, movement in response to rescue breaths. For assessment of pulse, there are different sites in adults, child and in infants. In adults, we should check carotid artery. In childs, we should check femoral artery. And in infants, we should check brachial or femoral artery. So now the question arises, why do we check carotid artery in adults? The reason is when the circulation is inadequate, the body tries to conserve circulation to the vital organs as long as possible. Thus, carotid artery pulsations are the last to disappear when cardiac output gradually reduces. Hence, it is important to feel the carotid pulse to identify the cardiac arrest. And why do we check brachial and femoral arteries in infants and neonates? So the reason behind that is infants and neonates have short neck and it is difficult to feel their carotid arteries. In them, the brachial artery may be used to identify cardiac arrest. If no pulse is felt, the patient is in cardiac arrest. Step number 4, give chest compressions. Site of compression. Compression should be given with the heel of the hand placed on the lower half of sternum. Care should be taken not to compress on either side of sternum as it may cause rib fractures. So now we will discuss technique of giving compressions. So what should be the position of hand and placement? We will discuss that. Place the heel of one hand over the lower half of the sternum in the midline. Clasp this hand with the heel of other hand. Keep the elbow straight and move forward so as to place the shoulders directly above the sternum. Rate of compression. Provide 30 compressions at a rate of at least 100 per minute. After each compression, we should give 2 rescue breaths. Now, depth of compression. Compression depth varies among adult and infants. In adults, it's up to 2 inches, and in infants, it's up to 1.5 inches. Now, let's discuss about the basic CPR in adults. Pulse assessment should be done on carotid artery in adults. We should use 2-hand compression method. We should place our hands on lower half of sternum between nipples and center of heart. Depth of compression should be 2 inches and rate of compressions should be 100 to 120 compressions per minute. Now we will discuss basic CPR in childs. Pulse assessment should be done on femoral artery. Compression method, we should use 1 or 2 hand compression method. Place of compression should be followed as same in adults. Compression depth is also the same, which is 2 inches, and rate of compression is also same, which is 100 to 120 per minute. Now the basic CPR in infants. Pulse assessment should be done on brachial or femoral artery. Compression method, we should use 2 fingers or 2 thumbs. Place of compression just below the nipple line. Compression depth 1.5 inches and rate of compression is same, which is 100 to 128 compressions per minute.
Step number 5, open airway. There are 2 methods among them. The first one is head tilt and chin lift method. In this method, the palm of one hand is placed on the forehead of the patient and the head tilted posteriorly to extend the head as much as possible. The chin of the patient is lifted up manually with the thumb and fingers of the other hand so that the lower incisors of the victim override the upper incisors. Since the tongue and the epiglottis are attached to mandible, chin lift also lifts the tongue and the epiglottis. But this method is not recommended for patients with neck or spinal injuries because it may lead to increase the chances of risk. And the second method is jaw thrust maneuver. This method is applicable for the patients with neck or spinal injury, road traffic accident or inaccidental injury related to spine, falling from height. Step number 6, give 2 breaths. In this step, the rescuer opens his or her mouth wide, makes a mouth-to-mouth seal and delivers a large breath into the victim so as to expand the chest adequately. He or she takes a breath in the form the atmosphere and another breath to the victim. Take 2 chances to deliver each breath. Now we will discuss compression and ventilation ratio. Provide cycles of 30 compressions and 2 breaths. 5 cycles should be completed in 2 minutes until help arrives or if the patient shows some sign of life such as breathing or movement. Normal ratio of compression and ventilation in 3 of them, adult, child and infant, is same, 30:2. And if we have 2 rescuers with us, so the ratio remains same in adults, that is 30:2, and it changes in case of child and infant, which becomes 15:2 in both of them. So now here we have shown step-by-step CPR guide. You can see 6 procedures shown here diagrammatically. Now let's discuss AED, automated external defibrillator. Defibrillation is used to restore heart rate and rhythm by therapeutic electric shock. It is mostly used in pulselessness, tachycardia and ventricular fibrillation. There are 2 types of defibrillator. First one is biphasic and second one is monophasic. So in biphasic, energy charge ranges from 120 to 200 joules and in monophasic it is 360 joules. Now points to take care before use of AED. Have checked that no one is touching the bed and before giving shock. We should shut down all the oxygen supplies. What is the position of placement of paddles? There are 2 paddles. So basically the first one is placed on base of heart and second one is placed on apex of heart. Now we will talk about advanced CPR. It is also called as ACLS as we discussed before. Advanced cardiac life support. We can provide advanced CPR in following points by using airway adjacents or other equipments, and second is drugs for resuscitation. Hello everyone. Today we are going to discuss on topic about CPR, which means cardiopulmonary resuscitation. It is also called as BLS, basic life support. It is an emergency life-saving procedure which restarts patient's arrested breathing and circulatory system. It helps provide oxygen to vital organs until help arrives.
Now let's talk about the indications of CPR. The first one is cardiac arrest, second one is respiratory arrest and carbon monoxide poisoning. The third one is accident or injury. The fourth one is electrical shock. The fifth one is foreign body injury or obstruction in body systems. And the last one is drug reaction or drug overdose.
There are 6 steps for basic CPR. Step first is assessment. It includes dilated pupil, apnea, absence of carotid pulse, unconsciousness, cyanosis and fits. Step 2, call for help and AED. Step 3, feel carotid pulse. Step 4, give chest compression. Step 5, open airway. Step 6, give 2 rest to breath. Help! Help! Somebody help!
Okay. Patient is unconscious. Pulse is not palpable. So we are performing CPR. Hands should be interlocked and placed over the lower half of the sternum between the nipples, and we have to give compressions. We have to give compressions at a rate of 120 per minute, and after 30 compressions we have to give 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And we have to repeat this up to 4 to 5 cycles. After rescuing the patient from emergency, we have to shift him to the hospital for the further management.
Now let's talk about the complication of CPR. Due to the forceful compression, there may be some complications. For example, rib fracture, flail chest. Flail chest means the connection between ribs and sternum there may be loose. After that, lung injury, abdominal organ damage, vomiting or aspiration, and pneumothorax. These may be complications arise.